Welcome. An excellent stretch exercise, another self-help video for you to share with your family and friends, is working the anterior front part of our neck. We realize that with the type of work that we do every day, a forward head posture, rounded shoulders, looking down, sleeping incorrectly with a big thick pillow with our head forward, even injuries like whiplash when our head is jarred back and jarred forward. Very commonly, we hurt the muscles in the front of the neck region, particularly in the suprahyoid region. Now the suprahyoid muscles, we have four main muscles, and those muscles are designed to take that hyoid bone and pull it upwards. There's two main stretches that we're going to do today that's going to release these tight muscles in the front part of the neck that's working hand in hand with these back muscles that are imbalanced. These muscles are contracting, they're pulling down. So therefore, a lot of your neck conditions or headaches or problems you're even getting back in the shoulders, you're getting because the neck is restricting the head movement. And as a result of that restriction, you're getting compensatory changes and pulling and inflammation because of that imbalance. Now, one of the main areas that we're going to focus in today is the suprahyoid. The suprahyoid muscles, there's four of them on here. The hyoid bone is at the C3 vertebrae. If you come across from the third vertebrae down, the top bone in the neck, you could actually come underneath the jaw if you want and make its way down the neck. If you push firmly in there, you'll feel something hard in there. And that is the hyoid bone, and that's where those muscles above it pull upwards, particularly when we swallow, when we jut our chin forward. Different movements of our mouth affect those muscles. So what we're going to do is I want you to take your fingers and go underneath the jaw and come down to that first hyoid bone and come real close to the front. Don't bring your fingers too far wide. And I want you to go down and just pinch that muscle. If you feel that bone, pinch those muscles with these two fingers. Your first and second finger, just pinch it. Now what I want you to do when you pinch it, I just want you to look up. Good. So as you pinch it, you're pushing down, and I want you to look up. Good. Just do it gentle, a couple times. Good. Grab that area, pinch it, and push it down. As you look up, you're saying, wow, that really hurts. I didn't know that can really stretch. Those are muscles you need to stretch. Now try this for a second. I want you to grab those muscles a little bit above it. Put your finger on those muscles above the hyoid bone. I want you to open your mouth like you're yawning. I want you to swallow. You see, just doing those actions, you're using those muscles. So imagine if you hurt those muscles, everyday movements or functions that you're doing anatomically and biomechanically, you are potentially causing weaknesses or problems if those muscles are very constricted. Now, the second part of this exercise is very important. We're going to work the SCM muscles, but where they attach. Now, I want you to take your finger and go all the way down to the manubrium. You can see on the chart here the manubrium, and I just want you to take two fingers and push it in and down. I want you to look up. Wow, you feel that burning in there, that stretching. Just go slow, hold it about 20 seconds, 30 seconds. Good. After that, you're going to take the same two fingers, come off the manubrium onto the clavicle right next to it, go to the left, push it down, in and down, okay, and look up. You'll feel that left SCM muscle, that's the attachment where it's attaching into. You're going to feel it really burn. Hold that about 20 seconds or so. Good. And now you're going to come to the right side of the manubrium, which is the right side of the clavicle. Okay, and you're going to push down in that. You're going to push in and down. And as you look up, you're going to feel that right side really, really burn in there. And that's going to really feel an amazing stretch right there. So quick review, what we do, we come down to the hyoid bone. We're going to grab right above, pinch right above the hyoid bone. And as we pinch, we're going to push in a little bit, look up. You feel those muscles, the suprahyoid muscles stretch. You're going to come down the throat all the way down to the top bone here called the manubrium, up top of the sternum. You're going to push in and down, look up. Good. You're going to come to the left, just left of it. It's the top of the clavicle. Look up. You feel the other side of the left SCM. Come to the right side of the clavicle, this right side of the manubrium. And look up. Good. And you're going to really stretch those muscles. You can do this a couple of times a day. It's very, very helpful. It's going to actually open up the whole anterior chain of the cervical region. You'll notice immediately after, as you move your head around, it's going to feel so loose. And this is where you'll see miracles, because once you release the opposite area, even though you're having pain back here and decreased motion and spasm or headaches, whatever it's going on, once you release this, this will really aid in the progression of the healing process, make you feel a whole lot better. Leave your messages below. I ask you to share this video with others. Subscribe if you haven't, so you can continue to receive the best of the self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandel.